Hi, and welcome to day 7 of the Holistic Fast. Things are going along really well. I'm feeling a little bit of upliftment. It's just starting the last 24 hours or so. I had gone as out of ketosis over the holidays, and so now I'm starting to get back into ketosis, and it's feeling really good. Just a little bit of bumps in the road with a couple little healing crises. And of course, with the healing crises, I encourage it, not discourage it. So instead of wanting to make it go away or do something to make it stop, I do something to make it even more intensified. And I'm talking about the physical level here, and also going into the emotional level, which we haven't really gotten into too much yet, but we will over the next few days. So today is a couple of interesting topics to me. They're topics that are really, I find very, very interesting, and I have done a lot of study around it, and a lot of contemplation and a lot of introspection. And those topics are vaccines and dental health. So my experience with dentists in my lifetime has been quite traumatic. And even on the table in my early years of body electronics, I had some dental trauma come up in the sessions. And even so much as when I was a young girl, I think I was about 7, and I went to this dentist. My mother took me to this dentist. His name was Dr. Brown. And I was really not happy about being there. I was really fearful. And he ordered my mother out of the room, and he pulled me up out of the chair. I wasn't being willing to open my mouth. And, he was shouting at me to open my mouth. And so I just clamped my mouth even further. And so he picked me up out of the chair, and he shook me, like really shook me, and threw me back in the chair. And so that was a really interesting memory that came up around dental, around my visits to dentists, that I needed to, of course, do what we do when we're transmuting, and that is forgive, be grateful for, and love the experience into the void. So you're no longer carrying any of that baggage, any of those memories, those traumas in the cellular memory. So that kind of started out my dental experiences, and as far as going to a dentist, that is. And later I had braces in my teenage years. I had braces for 4 years. That was, not, I don't think it was very productive to even having a healthy teeth and gums. So, and I'm not really sure if my teeth would have even been, if they had all just grown in, back then. I don't know what they do now, but they don't even wait for teeth to grow in before they start to, rearrange them. And I see a lot of people that have wisdom teeth coming in, and the dentist will say, "Oh, we need to pull those. Those are like they're coming in crooked," or something like that. But they end up coming back and coming right eventually if they're being left. In many, many cases, that's what I've observed with people. So anyway, to get to the point, my life has been in regards to dental health. I take full responsibility, and if I need to go to a dentist, I find a really good dentist who has great experience, who does not use mercury amalgams, who knows about root canals and the damage that they can cause, and who has the technology and the expertise to remove amalgam fillings, because it's really, really important to find a dentist that has all of the technology, all of the filtering systems that literally, if they are removing amalgam fillings from people, that you don't walk into a dentist's office that has that dust in the air, that mercury dust. So it's really important to find someone who really, really knows what they're doing, has a few years experience under their belt, and is very, very competent and knowledgeable in holistic dentistry. There's some books that I recommend. Any book by Hal Huggins is, it's kind of like they're going back now probably 20 or 30 years ago. Hal Huggins was really active in bringing awareness into dentistry. I also had a really great friend who was a dentist in Michigan, and he started, I can't remember the name of the dental foundation that he founded, but it was when he first did it, he was just absolutely vilified by the dental industry. People in the area just hated him. Dentists, hated him and spoke, really poorly about him. And he really traversed that very graciously. He's passed on now, but he really spread the news. He used to have big lectures in Las Vegas, and really educated people, way back when, we're talking decades ago, in the onset of holistic dentistry. So so it's really important to know what's healthy for our mouth. Of course, we have to completely do away with fluoride, both drinking it and using it in any form of dental care. Mercury amalgams, of course, if you did have them, they need to be removed. They are giving off toxic gas. Every time you chew, it's been shown that mercury amalgams give off this toxic gas that actually affects the brain and can cause neurological disorders. So that's something to really consider. Where do I want to go? I think that's about enough. I mentioned How We Heal. So How We Heal has a great section on that. And I think I might even put it on the post with today's on today's post. So yeah, just look at that, read through that. If you haven't ordered How We Heal yet, I really recommend that you do. It's been in publication for a little bit more than 20 years, and it's very relevant, as relevant now as it was then. So the next topic is vaccines. Wow, that's a big one now, isn't it? Because we have seen in the last 2 years plus, we're going into 3 years now, of the introduction of mRNA injectables, which cannot be considered vaccines by any stretch of the imagination, but they have been marketed as the savior to humanity. And unfortunately, a lot of humanity has succumbed to the propaganda put out by, we're not going to go into the core of the cabal, but it has come down through the pharmaceutical companies and into your, local public health, whether it be federal, provincial, or in other countries, whatever the AMA. Here in Canada, it's the Canadian Medical Association. So there's, it's this propaganda that these shots were going to do anything except damage you has been bought hook, line, and sinker, and I'm really sorry for that. So that's the first thing I wanted to say. I want to be really clear on that. Even I've started giving some in-person sessions where I do actually hands-on work here near Nelson, British Columbia, and I, at this point, am not having anyone come that has taken the shots. They can do a detox. I can assist people, and I am assisting people online to get into a detoxification program if they have realized that they have done, if they've taken these injectables and have had problems or have realized that there could be future problems. I'm helping people sort through that individually. So it's something I can do online, but when I do hands-on work, I'm asking people only people who have not had the mRNA injections to come for my in-person hands-on sessions. I put it very simply in the post that I wrote on this today, and that is there are communities on the planet who have not had vaccines, childhood vaccines. We're going now beyond this new, they call the mRNA vaccines, but they actually don't fit the model. But what they used to call vaccines, but they're still calling vaccines for childhood, and whether it be flu or whatever. There are communities on this planet who have not succumbed to those things. They have not taken them in their communities. And those communities literally have not the epidemic of autism. It's really, really that simple. We don't have to look at a whole lot of data to realize what's going on. I also include in my post today, if you don't know of Dr. William Makis, M-A-K-I-S, he is a doctor that's collecting data, worldwide data, not just here in Canada, although he is a physician out of Alberta. And you can find him on X. I think it's at Makis MD. And he is really keeping track of what's happening with the mRNA injections. So that's something to look at too. Just keep yourself aware of what's going on, so you can educate your loved ones. This is what this fast is all about. It's about educating. It's about educating ourselves, and then we can take that education and educate our loved ones. And that's the love that we can show to each other. It's not about resisting each other and thinking that people who have taken them are bad and people who haven't are good, or vice versa. That's not it. It's about education, seeing what's really happening, being aware of what's really happening, and applying that in our lives. And if people are open to it, like I said, educating our friends and family. So I think I'll leave it there for today. That I know they're two really, really big topics, and they really deserve a lot of investigation, a lot of research. Over the past 2.5, 3 years, I've spent hundreds, if not thousands now, of hours in the listening to people, listening to different doctors, different immunologists, different vexillologists. Dr. Byron Bridle out of Ontario, also a very great resource to listen to him. There's many who have and are standing up, speaking out, and following their conscience in this regard. So thank you so much for continuing on with the fast. We will start day 8. It's really going to amp up now. We're going from simplicity, which is the physical level, simplicity, into complexity. And you'll see that I will share something later in the fast around simplicity, complexity, simplicity in regards to consciousness. It's a really interesting process that we all go through. So thank you for everything. Thank you for watching. Thank you for listening. And my love to you.